From Cary in Florida, we turn now to NBC News Now correspondent Dasha Burns. She joins us from Appalachia, Tennessee, a rural community that was hit hard by COVID-19. So, Dasha, it has been 1 year now, and that region is finally starting to turn a corner. You were there in Appalachia during the peak of the virus. Talk to us about how the situation compares now.
Hey, Joe, good morning. We were here during some of the darkest days for this region. And, Joe, this is one of those stories that really stays with you as a journalist. Last time I was here at this hospital, Johnson City Medical Center, there was a mobile morgue trailer parked outside because the hospital had run out of room in its morgue. That is how quickly people were dying in this area. We spent time with nurses on the ICU floor here where the majority of patients were on ventilators, and we saw firsthand the heartbreak that was permeating those halls, the toll that was that these nurses were experiencing. And now things really have turned around, and I'll tell you, the numbers speak for themselves. The last time we were here, there were 327 people hospitalized across Ballad Health's facilities. That's the health system for this region. They had 68 patients in the ICU, 41 of those on a ventilator, and a positivity of 25%. Now, only 68 hospitalized patients, 13 in the ICU, 6 on a ventilator. And I'll tell you, Joe, right now in Johnson City Medical Center, there is not a single patient on a ventilator, Joe.
Obviously, Dasha, it has been a long year for those healthcare workers you were talking about. What are they telling you now as they look back?
Yeah, when we last met with these nurses, they were surrounded by death and darkness, and now they are seeing some life and some light. And talking to them, the energy was so different this time around. You could see some light in their eyes. But, you know, they liken this experience to having been in a war zone. And when you come back from that, it stays with you. You don't just turn right back around and go back to normal. I want you to hear from Alison Johnson. She's a nurse of 17 years, and she talked about what it's like now having some time and space to reflect. Take a listen.
Experiencing so much death and heartbreak of the families, I think that's the piece that I think, should we have done things differently, or how could we have done things better? Could we have done something different? But I feel like we did the absolute best that we could do.
We spent some time with Alison and her family on their family farm. We spoke to her husband, who is so proud of his wife for her resilience, but says he has seen the toll it has taken on her. And her children, 11 and 5 years old, are proud of Mom for, they say, saving lives every day. Joe.
Dasha, so glad you were able to check back in with that community. Thank you for your reporting.
Turning now to Washington.